Hey everyone, this is week 6 because we skipped week 5 of treatment planning. And this week is all about anxiety disorders, which encompass a lot of the disorders because anxiety is such a big thing. So I'm just going to go over a quick recap of everything. Don't forget that your paper is due on the 21st this week. Get that in. I'll get those graded hopefully within a week. So look for your results on D2L, okay? And if you have any questions, just let me know. So it starts with obsessive compulsive related disorders. So meaning that we have intrusive thoughts which lead to behaviors, and these behaviors either take up a lot of time or they cause us to have some anxiety about them, or both, okay? And so we have a lot of things that fall kind of under this umbrella, but definitely you'll hear people in society say something like, oh, I'm OCD about that, which is just another way to marginalize this population because this population really does struggle with the behaviors and the thoughts that they're enduring. So we have about 2 to 3% of folks are diagnosed with obsessive compulsive disorder. So we have the obsessions and we have the compulsions. Think of obsessions as in your head, right? Like that hamster on that wheel that just won't get off, and it's making you think through all these things over and over and over, but it's not things that really help us get through life. Then the compulsions side are actions, right? Behaviors, things that we're doing as a result of these thoughts, that we're trying to get rid of these thoughts. And for a lot of these folks, when they engage in these behaviors, then they feel this sense of relief that's temporary from engaging in the behaviors. And so that creates kind of a reward system, right? Like, okay, at least that relieved my thoughts for a little bit, so I'm going to keep engaging in that. So we can understand that with this population across the board, we want to make sure that we're having an inviting environment, right? They could be embarrassed about it. They could really struggle with it. They could have anxiety about their anxieties. So we really want to have a safe, comforting, understanding place for them to come so that we can work on it together, the pieces that aren't working for them. Okay, so I'm just looking at the PowerPoint really quick to make sure I don't miss anything. Different obsessions and compulsions are listed on the PowerPoint for you to look at. We think about this cycle of it, like we have like this thought, right? And then it makes us panic, and then we engage in this behavior, and then we have relief. And so then it just keeps going. We want to put a stopping point in there so that they don't have to keep cycling through this. There are lots of different treatment options like cognitive behavioral therapy, and we do a lot of different things with that. We have the acceptance and commitment therapy, hexaplex. And so I've got that a couple different times in a couple different ways to look at it on the PowerPoint, both at the beginning and then at the end with the trichotillomania, okay? There's always psychopharmacotherapy, which is a nice way of saying like medications. So maybe it's like an antidepressant or an SSRI, a selective serotonin reuptake inhibitor. If the obsessive thoughts are really like delusional or really intrusive, we might prescribe it or have them be prescribed an antipsychotic, okay? Hoarding disorders are about 2 to 6% of the population, so that's a bigger percent. And definitely we start to see these things before the age of 20. Sometimes we see trauma or loss occur before the hoarding starts, but it's generally this thought of like, I need to hold on to this. It could be significant to me now. It could be significant to me later. I don't want to undergo another loss. So I do have a small short video on there if you wanted to watch that. It's always under like 3 minutes. And CBT again. So you'll see a lot of this cognitive therapy, cognitive behavioral therapy, because we're having a thought, we're having a behavior. So obviously we're thinking, oh, cognitive thought and behavior therapy would work when we're talking about thoughts and behaviors, okay? But this one we also add in the motivational interviewing, which you'll remember from addictions class is something where we look for change words, where they're saying, I realize that this is a problem or problematic for me and I want to do something different, or I did do something different this week. We want to look for that and encourage that. So it started with like gambling, alcoholism, drug use, that kind of stuff. But we found that it really works for a lot of other diagnoses too. Body dysmorphic disorders, where someone sees or perceives a flaw in themselves, which is either very slight or that other people don't even see at all, but then they fixate on it. They spend a lot of time looking at it, trying to adjust it. Maybe they get procedures done. Maybe they exercise a lot. Maybe they take steroids. There's a whole lot of stuff that can be really detrimental to this population. So we want to work with that. Again, the CBT, we do some mindfulness stuff. We do some inference-based therapy, exposure therapy. Then you have trichotillomania, where folks are pulling pieces of their hair out on their arms, on their heads, eyebrows, eyelashes, and they tend to be doing it. It could be on your face. You're doing it while you're doing something else, like reading a book or watching a movie or something like that. You're just kind of doing it, okay? And people will see it, and of course that can be embarrassing, and hair can tend not to grow, you know, back fast. All of these things, in a nutshell, are things that create anxiety. We have excoriation, where you're picking at your skin. That could start at puberty because you start to get like acne, and so people are poking at that, or it could even just be like picking at scabs. People could put the hair or their scabs in their mouth. They could eat them. Lots of different things, which you could see why folks would be embarrassed. So again, the main foundation for all of this is understanding, safety, respect, and collaboration. Like, we're here to help. Show me how we can do it. We always want to talk about how anxiety presents in their body, help them find ways that they can move through that. And we want to help you find ways to move through your anxiety too. Do something this week that promotes your wellness, and know I'm caring about you. I'll see you next week.